I think we'll have to get started on our meeting today, our Older Adult Advisory Committee. And I think we will start with the Pledge of Allegiance, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I know it's always so nice to visit and talk, and I hate to interrupt, but we have to get to business, I think. So at this time, Adriana will we'll do the attendance roll, please.
Betty Bishop, Rochelle Fuquay,
Here.
Jennifer Hamill,
Here.
Niels Olmholt,
Here.
Suzanne Ostash,
Here.
Vito Pianello, Phil Randazzo, Marcia Relier,
Here.
Joe Silbernagel, Moira Smith, Carol Thompson, Barbara Vansickle, Carol Weidenbach, Kathy Western,
Here.
Roy Wilson,
Here.
and Carol Weisman. That completes the roll.
Good. Thank you. At this time, I'd like to call for an approval. Do I have to do anything else after that? With that? We're good? Okay, we have approval of the minutes. Hi there. Is there support? Support. So the minutes were approved by Barbara Van Sickle and supported by, so sorry. She's from Fraser. We went to school there, probably together, maybe together. Good, thank you. Did we vote now? Yes, all in favor?
Aye.
Any nays? Okay, thank you. At this time, can we have an approval of the minutes?
So moved.
Marcia?
Second.
So who supported? Rochelle? Is there any discussion? Can we take a vote? Do we take a vote now? Okay, thank you. It's different without the machinery, I think, a little bit. I'm sorry? Yes. I'm sorry, what'd you say? All in favor?
Aye.
Aye. Any nays? No, thank you. I now need a motion to approve, we have public opinion. We have public participation, we now have public participation for anyone here that would like to speak for 3 minutes on anything on the agenda. There will be another public participation at the end of the meeting for anything for anything to speak, that you would like to speak on. Is there anyone here that would like to speak? First, second, third, finished. Thank you. We will now go to presentations. We have, we're very fortunate to have Macomb Animal Control Chief Jeff Randazzo here. We will also have care of Southeastern Michigan, Susan Stife, after the chief. Can I get a motion to receive and file? Barb Van Sickle, motion, support. Carol, thank you. Do we take a vote? We don't take a vote now. Okay. Chief, what do you have for us?
Well, thank you for inviting me today. I greatly appreciate it for a chance to talk about Macomb County Animal Control. And I'm proud of all of you because I think our Adult Advisory Committee is a very important committee. And as you see, as we go through the presentation, you'll see where even at the animal control level, we try to reach out to our older adults through some programs that we have. So I'll share some of that with you. So again, thank you for the invite. So for Macomb County Animal Control, what do we do, right? So what does Macomb County Animal Control do? And these are all of on the board, as you can see, it's all the things that we do, but I would say our biggest the call for service we get the most is animal welfare. and it's about checking on those animals, especially during times of, inclement weather. So on a very hot summer days, then we also have, when it's really cold out, think of all the communities where the animals go in the canals, they run out onto the ice, all that type of stuff. So I would say the majority of all our calls are really made up of animal welfare. And if you think of animal control, just like any law enforcement agency, most of it's all complaint driven, right? So someone is walking down the street, there's some loose dogs, or they see sick wildlife, because we also do wildlife. We also, help remove all the dead animals in Macomb County. That's one of our things that we kind of pride ourselves on as well, because we're the only county in the state of Michigan that does that. And for me, it's really important because I don't want any of our residents or people that are transient through Macomb County to see our roads littered with carcasses. So for us, it's really important that we always keep our image. We became #1 in the state for a reason, and it's because we have great practices in place. But as you can see, these are all the things I listed up there. So we assist the public. We do vaccine clinics, which we'll get into in a little bit here in this presentation. But I just want to, have you know that most of it's really animal welfare. We service 21 communities. So unlike, the sheriff's department or city or township police department that might be focusing on a few communities, we focus on the entire county except for 4 communities. So Sterling Heights, Warren, Mount Clemens, and East Point, they have their own animal control division. So although we always offer mutual aid, we basically have the whole county except for 4 communities, which we have listed here. And then you'll also see, oh, I think that went a little too fast. It has its own mind, I think. But so what makes up animal control? I'm the director, I'm Chief Randazzo, and then I have an administrative coordinator. We have 2 part-time veterinarians, so we don't even have a full-time veterinarian as Michigan's largest animal control division. So we hope to change that in the future. We have 6 deputies to service those 21 communities, 20 communities. We have 7 kennel technicians that work 10-hour shifts, 7 days a week. 365 days a year. So regardless of a holiday, we still have animals to care for. And then we have 5 dispatchers, one of them being part-time. So just that's where the makeup of the staff at Animal Control is. And then this is kind of a breakdown of those calls going into those communities. So every year, this is 2022, we responded to 5,156 calls for service. And you could kind of see, we kind of did a chart there for you. So you can see the busiest communities, being Clinton Township, Chesterfield, Roseville, St. Clair Shores, Shelby Township, Macomb. So if you represent those communities, you could actually see, how important it is that animal control plays a role in those communities. And as you could also see from the pie diagram, there's a big deal of stray animals, unfortunately. So if you think of the northern part of the county, there's a lot of communities that do not allow fences, right? So they have pets, but really there's no good way to contain them. So hopefully in the future we could fix that, because if you think of them having a pool, part of the permit process is that you have to have a fence around your pool, because you don't want anyone to accidentally walk into your pool, right? So for safety purposes and public safety, we have a permit process that when you have a pool, you have a fence around it. Well, if you think about it, if you had 2 big dogs, right? Because in Macomb Township, you could have, 2 big dogs, right? In some of the communities, you could have 4. So to me, it's like, well, why would we not want to give those people fences, right? If you think about it. And as you can see on the pie too, see where it says transport? It is because Macomb County Animal Control, we do not have a surgical suite. So all the animals which are required under state law to be sterilized, we have to transport them to contract vet clinics every single day. So we have partnerships with our local vet clinics, and we actually have to have staff, which make up, a deputy or a kennel technician, drive them over to the vet clinic, get their surgeries, and then bring them back. We would hope to change that with a new building that would have a surgical suite, and save all that time. You can also see that we assist our police departments. So if you think of those communities that have their own police department, over the last few years, if you think of evictions or if there's been a serious crime there and they have animals, then animal control comes in and we actually remove those animals for them. So this is our shelter spay and neuter. So by law, Michigan state law, all the animals that we adopt out have to be sterilized. So think of, now the transport piece, but there's also a cost to that, right? And if we think of cost of veterinary prices going up, unfortunately, we're at their mercy. So this is just sterilization cost. This does not include medical injuries, illnesses, upper respiratory infections. This is just sterilization. So for our adoptable cats in 2022, we adopted or sterilized, you could see 168 male cats, 156 female cats at a cost of $25,000. And then our adoption dogs, there's 171 males, 167 females at a cost of almost $40,000. Then we have a community cat program. So hopefully, those of you that don't know this, in 2013, with the help of the county executive and the Board of Commissioners, we were unfortunately euthanizing over 6,000 cats a year. So when I came on in 2013, one of the first things we decided to do was listen to experts at the University of California, Davis Vet School and the University of Florida Vet School and come up with what we call a trap, neuter, and return program for cats. And we were able to do that through a lot of grant funding. And since then, we were the first county to ever launch a TNR program where we actually can save those cats' lives. And through spay and neuter, through our TNR program, those cat populations have diminished greatly. So that's really important. But that community cat program costs about $12,900 a year. But that's what it's costing us to do that, which is a lot less than paying someone to humanely euthanize those cats. And we always want to have best practices. So all of our communities in the entire county participate in TNR. So that's a really important step in the right direction, I think. So the next slide is going to talk about our intakes. So the total amount of intakes is 2,538 animals. But right below it, you see live intakes, and that is all the animals that enter the building live, because remember, we do pick up deceased animals on the road. So we take in, about 2,000 animals, and it's less and less every year, which is great because we do have life-saving programs. So as you'll see in a minute, we have pet retention grant that we were lucky enough to obtain. We partnered with Bissell Foundation, their pet foundation, to help us place animals and give us grant funding to help cover the cost of some medical for animals. But out of that 2,000 animals that we've taken in, you can see we adopt out 815, 412 returned to the owner, 275 of them were community cats, so they're placed back out in the public. And then we have 281 animals went to our partners. So, Grand Traverse, Ingham County, different animal rescue organizations. So it's all about collaborating, right? It's kind of like it takes the village, right, to get all these animals saved. And you think about 2,000 animals, it's a lot of animals coming in the building every single day. And the goal is, how do we divert that? And so that's through life-saving programs. So one of the programs we have, especially during COVID, that we were so happy to get up and running again, were our vaccine clinics, which usually we host at Freedom Hill over in Sterling Heights. So roughly we're running, for our vaccines was about 1,000 vaccines per clinic. And then microchips were about 100. Well, then I thought, well, I still know the needs out there. Like, how could I reach all these people, right? Whether it's homebound seniors or is people that are pet parents having financial hardship, how could I really reach them? And the way I thought of it was to get it all sponsored. So nobody had to pay for anything. That if I set up the clinic and that the residents knew they didn't have to pay for anything, all the pet parents would come. And as you can see, from September 2022, which was our first sponsored vaccine clinic, look how many vaccines. We doubled the vaccines, right? So we did over 2,000 vaccines and over 380 microchips. And the microchips are important because that's where our return to owner comes back. So if we're out in the field, we pick up a stray animal, we could just scan that animal, we'll know right where it lives, and we bring it right back to the house. We don't want it coming back to animal control. And that really helps out the pet parent too, right? Because they don't have to pay the impound fees and be worried about where their animal's at. But the vaccine's a really important piece too, because we also sell our dog licenses there, right? Right on site. So it's kind of like a one-stop shop. Vaccinate, microchip, get your dog license, and you're on your way, right? And 2,000 vaccines. We were there all day. But it's such a great feeling, right? Because you're doing all this community outreach and you're kind of bridging that gap. So we know that there's a lot of pet parents that are having trouble finding the finances to just do basic wellness, which is just the basic vaccine, basic heartworm testing. And so it's like if we could provide that at no cost, we know that needs out there just by doing 2,000 vaccines and almost 400 microchips. So we're going to keep that up. So the other, just talking about community outreach, I think for our seniors, we run a program called Fill the Trailer. And every year we put our trailer out in front of our Pet Supply Plus and we have people donate. And every year we get about 17,000 pounds of pet food. And then we team up with Macomb Community Action Senior Program and we get that food delivered to all those seniors that are homebound. Because we want to make sure that we're bridging the gap, that we're reaching all those citizens out in our community. And so we started that program several years ago, and it's been extremely successful. And that's why, in the beginning, I applaud all of you because I think it's so important that our seniors know that there's help out there. We want to make sure that they have that avenue and they know how to reach out to us. So we were talking about pet retention. And so since COVID 2020, we spent about $60,000 in pet retention. And this year, again, we have our $10,000 grant out there. And it helps pet parents who are experiencing an emergency so they don't have to surrender the animal. But maybe if we give them $500, it'll help bridge that gap so they don't have to euthanize or surrender their animal. It helps subsidize that cost for them. And so we've been very successful. Last year in 2022, we helped 27 families. So that's 27 pets were able to stay in their home, not come to animal control or be euthanized because their family just could not afford medical care for them. So I think that's an important program and a really great definition of community outreach. And again, it goes back to families experiencing hardships because we know that those hardships are still out there. So this was a program we ran last year. It's called 586 Feral Fix. So we did have grant funding again for those TNR cats. We see a lot of these in our community, and we want to make sure that people know that there's help out there. And we sterilized 400 cats just with this grant. So that doesn't include the TNR program that we were mentioning earlier. This was something completely separate. And that was 400 cats that we sterilized and vaccinated and ear-tipped. And so again, this is a great example of doing a lot of community outreach. And for us, I think it's important, as we keep going into the future, we keep seeing that there's really still a need out there. And we really have to do our best to make sure that we're making, we're finding out where the needs are and we're making sure that we're reaching out to all those pet parents to make sure that they have resources for them to make sure that they can care for their pets properly. And again, we're #1 in the state. We have over a 90% save rate, which is something that we're proud of because when I first started in 2013, we were, #1 at being one of the worst municipal animal control divisions in the state. But it shows you that with good leadership support from the county executive, the board of commissioners, committees like yourself, we can do it, and we've done it. And we did it within just 4 years of getting to #1. So I just want to say thank you all so much because it is with all your support that we could do these great things. And I'm here if you have any questions. One of the things I would love to talk about is volunteer programs. So if you go back to your respective communities, your adult advisory committees that you have in your local communities. They could just sign up to be a foster parent, which we always need, and they could find out all that information on our county website under animal control, volunteer opportunities. You know, there's tons of stuff, as you know, I know Commissioner Zenner knows just from being there. There's a lot of stuff you could do, and we will walk you through every process. I welcome all of you to come do a tour because it's your county animal control, and you should really see it. You can see how much we need a new building. We're the only ones. But do you have any questions? Did you like your presentation?
How do the seniors who might be homebound or not get out, how do they know about your services for them if they have a dog or a cat that they're caring for and might need attention?
They could always call us. Just call directly to Macomb County Animal Control.
Do they know you even exist?
Well, there's a problem, right? So there's what I feel like we have to, you know, find a way to make sure that information's out there. So we teamed up with Macomb Community Action Senior Services so that if on their routes or if anybody contacts them, that they actually know that help's out there. And so we worked really hard with over the last 2 years with Macomb Community Action Senior Services to make sure that our links were always shared together. And even with MCREST, you know, like for people that were homeless, temporarily homeless, that, you know, we could provide them with food or vaccines or, you know, something to help them in this transitional period. So we were really blessed because Macomb Community Action helped us out so many times last year. And they have a lot of great resources as well.
Well,
But
you're
it's about
helping-
collaborating county resources. Sorry.
You're helping them out too. I mean, it goes both ways, doesn't it?
It really does.
Yeah.
I mean, they helped us out with a lot of cases last year, and they have a lot of great resources. But I think you know, when you team up with other county entities, it really shows that collaboration works, especially at the county level, because we have a lot of great resources, but it takes some resources from like senior services, from animal control, because it's not a one size fits all. And it might not all fit into one department. You know, we might need, you know, animal control, you're gonna do this aspect, senior services, you're gonna do this aspect, and, you know, maybe the food program. So I think sorry. This is why I'm not allowed to have a podium. But I think it's all of those things, community, you know, involvement that we have to get out there.
Couple questions.
Sure.
You do 20 communities, but I'm from Warren, so if somebody wanted to get their stray cats neutered, can they bring them to you, or do they have to go to Warren?
They go through Warren, because Warren has their own TNR program.
So where you have housing for, like, people going into the hospital to take care of their pets, I don't think Warren has that, do they?
Warren does have a animal rescue. It's called I Heart Dogs, and I believe it's on Groesbeck, a wonderful organization, and they do sometimes temporarily house animals for that.
When you said McCrest, that you help with McCrest, so if someone came into McCrest and they had a cat or a dog, would you house them for them while they're in the shelter?
We don't house at animal control, and it's specifically because, one, we don't have space. Number two, because of the population of animals that we take in, that we never want to expose their healthy pet to animals that we have no background on, other than the vaccines that we just give them upon intake.
How did you help McCrest? I'm curious.
So we supply them with like dog food at some of the churches. And then if they have a resident that needs vaccines, there's some of the residents or citizens, they needed to get their animals like veterinary care, so we were able to do that.
Because McCrest doesn't have animals, that's why I was just.
Well, it's people that attend the churches, like my brother runs a church in Sterling Heights. And so if he has someone that comes in and says, hey, we have someone here, we're gonna give them human food, do you guys have any food that we could help feed their dogs? Or can they get veterinary care for their animals? So that's one of the things that we reached out with McCrest. So I know
Through a church, but not McCrest. Because
Well-
McCrest doesn't allow pets in as
Well,
of yet.
correct, and that's one of the things that they're working on now with another organization. So we're teaming up to find housing for those animals. So if someone's, you know, trying to get into a program, or if they went to a church, the church would notify us and say, there's somebody here. So that needs, you know, their animal might need medical care, and so we do all that part of it other than the housing.
Okay, but you're working on trying to help with housing.
Yeah, we're working with Detroit Pit Crew. It's another
Right.
great organization. So we're trying to come up with the housing piece. And unfortunately, at Animal Control, we don't have any housing. I would love it if I could maybe, have a few kennels that were designated, but like in a separate area where our animals that are stray that come in that we have no idea about their health, they're away from them, like a true isolation area.
See, like the new building at McCrest that we're working on, where we're gonna have an area for, I'm on the board of McCrest, that's
Okay.
why I was questioning. We're looking at building a separate, attached room for the animals. Is that something the county would help us with?
You like getting the kennels set up and stuff?
Yes.
Yeah, yes. So we could try to find some funding to get really nice kennels put in. So I could, if you want to talk or give me your card, we could definitely work on that.
Okay, thank you.
Yeah, because I know I was talking with Detroit
Huh?
Pit Crew about that
Oh,
too.
yeah.
Because I would love to do that. Unfortunate part is that, I don't know if you've been to our animal control, but it's, right now I have hogs in the garage, so the state won't let me just have a true isolation area. But as far as the veterinary care, that part's, pretty easy to get the funding for. It's that housing, for somebody, because you don't know how long they might be in a program. So it's that indefinite amount of time. So I think that, but that's a really good aspect of it, if you think about it, because there's a lot of people that utilize that service,
They would, yes.
right?
Another question,
Yes.
over here,
Oh, sorry.
the cost on some of the fees, are those on the website?
The cost of our fees to the
Yeah.
communities?
If I wanted a dog vaccinated or a microchip, are those fees on that website?
Yes.
Oh, they are, okay.
Right, but keep in mind, so the vaccines, we only by law can give because we don't have a full-time veterinarian. And we don't have a clinic open to the public because we don't have a full-time veterinarian. So the vaccine costs that you see, like when we do our vaccine clinic, we pay the vets to be there all day. They have to be on site, but we do not give out vaccines unless you're in a program that's through the county. There are some stipulations that we could do. So if we host a vaccine clinic, we just have to have the veterinarians there
And that clinic is done once a year?
twice
Twice,
a year.
okay,
So we do a spring and a fall.
thank you.
Years ago, my wife and I were looking for a dog a shelter dog, and we went out to Oakland County, and I say years ago, 20, 30 years ago. And it was very nice because they had a whole lot of dogs. You could go down aisles and look the dogs over. Recently, I tried to look for a dog at Macomb County, and partly because of COVID, it was like by invitation and name of the dog and come out and see it. Well, that really didn't fit too well because I wanted to look a bunch of dogs. I didn't just want the
Right.
first dog I looked at. Do you have a good way of looking over dogs that you offer up for shelter?
Do you mean in person?
Yeah.
Yeah, so right now, what we ended up doing, because during COVID, before COVID, you could just walk in, right? And since then, you've been to Oakland County, they have a brand new building, and it's beautiful.
Yeah, I was to the old building. Yeah.
Right, it's completely separate. So one of the things that you see in new animal control divisions is criminal and adoption are completely separated, right? So what we found at the front desk was that you might have taken someone's animals from the night before, or you removed them for a cruelty case, and at the same counter, you now are trying to have somebody adopt a pet. And so they're totally two different emotional states that these people are going to be in, but they're sharing the same window. And so what we noticed is during COVID, when we didn't allow the public back there all the time, the animals are far more calmer. So we have had discussions so when you walk back there, like if you ever do a tour, one of the things you're going to see is what we call barrier reaction of dogs that are placed in kennels. And you're going to see them hit the glass and they're going to, just kind of act up. And it's just an anxiety thing that shelter dogs get. So what we do is if you have an approved application, then we set you in a room with the dog. We bring the dogs to you. so that you don't go into the back of the kennel and then all the dogs, every 5 minutes are being excited and, just kind of hitting the kennels and just kind of acting out. It's a very interesting animal behavior to see because it's all done on repetition, if you think about it, right? So every time that someone had walked into the kennel, the dogs were like, pick me, and they're just all excited. And then you'd walk out, and then they would calm down. And then the next person would come in, and then all that would start again. So what we noticed is during COVID, when we actually had the doors shut and no one came into the building, the dogs were always quiet. And we played music for them, and we kept them quiet. But the downside is the adoption rate, right? So we teamed up with Pet Supply Plus. We're having an adoption event this Saturday. So we have to be far more creative in marketing those animals. So they are on the websites. We share them on Facebook. We use social media a lot, but it's not the same as bringing people in the building.
No, I look at the website, but you got to see the dog.
You do? Yeah, because I think they pick you as much as you think you're picking them. So that's why we have yards and we love to, put you in the yards and stuff like that. But we have talked about, just opening the door. The difference is if you think about a lot of nature of what they're doing, like we just removed 3, pit bulls from a house in Clinton Township where unfortunately there was a murder scene at. We do not want those people coming to animal control and trying to get their dogs. It would start a big ruckus at the front door, and which is what we don't need. So it's a really not set up to perform the way it should be performing, right? If you're going there to adopt animals, that should be through a totally different door. If you go to Oakland County, something totally separate. Michigan Humane, somewhere separate. If you're in violation, maybe your dog got out, or you're there to answer or respond to citations that you received or court hearing, then you should come in this door and you should be greeted by these people. So it's a lot to share at one counter. It's a rainbow of emotions going on.
I would love to see a field trip of all of us, go there and to be able to take a tour of animals is, one of my loves. But do you happen to have like a bulletin or a poster that could be posted like in like my city of Harrison Township where we could have something like at the library and maybe at the senior center, so, word could kind of get through mouth by that. Somebody could see that and say, oh, I know, my aunt who could really need some help with an animal, and we could get that word out somehow.
Sure, I could send you our flyers.
That would be great.
Yeah, I could actually, I will send them to
You
you.
want to send them here?
Sure, I'll send them to you, then you could
Well,
distribute them. Yes. And especially if you like I said earlier, if you go back to your communities and you know of anybody that you think, could use food or vaccines, or, maybe you have a program or that you would like us to team up with, just let me know, and I'll definitely see if there's something that we could, do, because like MCREST, I think that's such an important aspect that we have that we kind of, bridge that gap too.
I know my mother, who was an animal cat lover, she would feed all the cats in the neighborhood, and there'd be, at no given time, 15 cats or kittens on her porch, and she would feed them all. And, but she was from Warren, so I know you have your own system there. So for somebody like that who loves to help animals and they're always on their porch, it would be wonderful to be able to say, hey, we can help some of these cats and kittens and maybe get them spayed and neutered.
Yeah,
So
we
they
definitely
just
get them
don't-
spayed and neutered.
Yeah.
Absolutely, because if we don't do it, we know what's gonna happen in 3 months, right? We're gonna have double the amount of kittens.
That's right.
Yeah, yes.
Do you have your own website where the dogs are listed, or it's all on Pet Finder?
So you could look at them on Pet Finder, but they're also a link under our county website, Animal Control. On our county website, just click it. And then also on our county website is all our resources. So maybe we're running a grant and it's for medical, or, it could be for a million things, could be for TNR. So it'll say resources, and you just click on resources. You could, all our stuff about our grants, our TNR program for the cats, fill the trailer for the seniors, it's all on there.
So do you have your own website, or am I looking under the Macomb County?
You can look under Macomb County. Everything's under Macomb County Animal Control. The county has all their departments.
Yes.
Just click on animal control, and you'll see on the left-hand side, there'll be all the links that you could click down. And we update it all the time, so if there's a new grant coming, you're gonna see it. All last year, the 586 feral fix, that was on there, because we want to use that grant. So we're hoping that get that back again.
When I get the flyers from you, I can send everybody an email and notify you, and I can include the link on there too, if that would help.
Yeah.
Yeah.
And then we're also on social media, so on our Facebook page, we'll also launch a lot of stuff as well.
Are there any more questions here? I have a couple.
Sure.
Do you do your food drive once a year, or how many times a year?
The Fill the Trailer is once a year in the fall.
Okay. And,
We team up with Pet Supply Plus in Clinton Township and Sterling Heights for that. And again, that will be on our Facebook page. It'll also be on our county website.
Are a lot of your pets at your shelter, or are they out into people's homes? where
Most of
they're
the pets are
fostering?
at animal control, but however, a lot of them that need fostering for medical or, whatever reason, they're in foster care.
Do
And
those
they're-
come to Pet Supplies Plus too, where they're adoptable?
They do. Yep, the foster will bring them back and forth to Pet Supply Plus. A lot of Pet Supply Plus, we also teamed up with other organizations because we want their dogs. We solely use a lot of Pet Supply Plus for our cat and kitten adoptions. And then we know that our local partner, Animal Control Rescues in Macomb County, we try to get them in there, once a week too, to, advertise their animal, because we know it's important. So if they free up, then a lot of times they'll pull our animals and then, bring them over there too.
Chief, I noticed when you were showing the cities and the lines going up high, like St. Clair Shores had a high line. Now, you just took them over. I mean, they just brought you in to take care of their animals, I believe, this year, right?
No, I believe we started that in 2000. No, we've been doing it for several years. I feel like 2015 or 16.
Oh, really?
Yeah, I believe 2017 we started Roseville.
Okay, okay. I wondered if a couple of those were newer cities or townships for you.
No, St. Clair Shores and Roseville would be the two newest of the cities,
Yeah.
but we've been doing them for several years.
Oh, okay,
I want to say 2015 or 16.
all righty. So I just wondered if the areas that you've been under control, except for possibly the north, especially because it's so open, if you had it more under control because you've been with them longer. But I guess it's just the way it is.
Yeah, you're talking about because Shores and Roseville are busy?
Well, their lines, I didn't notice Roseville, but I noticed Shores and Clinton Townships, their lines were quite high.
Oh, yes. I think a lot has to do with population.
Yeah,
And then I think the other, piece, regardless of the population, is, well, I guess I probably would say it's population, but Shores themselves, if we look at Shores, because that's where I'm from too, right?
right.
So for Shores, I think it's, and I would like to think that all of our cities would give a great level of service, right? But I just think because of the way that the houses are, everyone's very tight together. If we were, in Warren's a very busy city. I just don't unfortunately have stats for them, but it's very busy. So I
Right.
think the southern part of the city or the county is very urban. And then when we go up to the north, it's, has some rural pieces to it. But something to keep in mind is when something happens in the north, like it's going on right now in Armada Township, it's this huge undertaking, because we're working on a farm and, you're probably talking 60 animals. And last year in New Haven, we worked on a farm and we had taken in probably almost 80 animals. And you're talking livestock. So it's very hard when something happens like that, it really overwhelms the resources. If we look in the southern part, if we're dealing with dogs and cats or maybe wildlife, like human wildlife conflicts, even though it's busier, they're usually sometimes more easily resolved.
Yes.
And over the last few years, we've seen a lot of evictions, you know, probably due to COVID and some
yes.
other things. So when we
Yes.
do evictions, those include those numbers. And that was, you know, a reality that we really started to see in 21 and 22.
Yes. Yes,
It's
sad.
sad.
As you can see, Chief Randazzo is just full of energy. His mind is always going. I get tired just listening to him because you can just see all the things
That's why I have
going
gray
on.
hair though at 50.
And he really has a passion for animals and just helping. He's a very great resource, and he's a very great person for the county. And I really appreciate all that he does for animals. And animals are dear to most people. Some people are afraid of animals, but for those of us that like our cats and dogs and all kinds of animals, I came from farm family. I like cows. I don't have a cow, but it doesn't mean I don't like cows.
I love cows.
Anyway, so is there anything else that we covered it probably? Thank you so much, Chief, for coming. You're very informative as usual, and I know everyone here will be thinking about everything that you said, and a lot of good information for our areas, for all of our areas.
Well, and thank all of you for what you do, because it's, you know, it's about working together.
Yes, it is.
You know, it's definitely something that's really important. You know, we talk about bridging that gap, reaching out to our communities. Well, it takes all of us to do it, right?
Yes,
So I'm proud of all of you too. It's teamwork.
Thank you.
Thank you so much. Have a nice
Thank you.
afternoon.
Thank you. We will now hear Susan Stife from Care of Southeastern Michigan. Hi there.
I have a saying in my business, because we're a nonprofit and we have to fundraise, that the worst is we cannot compete with animals. People who take care of animals or babies. Everybody wants to give money to animals and babies. So here I am following this. It's going to be challenging.
Well, we're really, really glad you're here. Thank you very
Well,
much.
thank you. Okay. So I'm Susan Stife. I'm from Care of Southeastern Michigan. Is everybody familiar with Care or heard of Care? I know Marcia has. Everybody here should have, because Marcia works with me.
Yes, yes.
Okay, so we are a nonprofit in the behavioral health field located in Fraser. We have been around since 1977, so we're a very long-standing nonprofit, especially one that's not associated with a national brand, like you would see Easter Seals, for example, so our United Way. So that's pretty remarkable to be sort of that small hometown nonprofit that's been around that long. In 1978, we started our employee assistance line. Our history from Care is we started out as screening for substance use issues. And since then, we have grown significantly. As I talk about our services, what I'm hoping to do is sort of give this overall arching concept of what we do and then narrow it down to our programs, a lot of what Marcia does for us, that really relate to this committee. Things I like to really talk about is I'm a social worker. I've been at Care since 2016, and in 2020, July, I became the CEO when our former CEO moved out of state. So you can imagine it's been a very, very, very difficult 2.5 years to be in the nonprofit world during the pandemic. So I jumped on the opportunity to come and present because I have not had the opportunity to get out and meet everybody. Okay, so things about Care that are unique that I think are really differentiators for us. We are CARF accredited. If you work in the behavioral health field, especially the public mental health field, having a national accreditation is really important. Ours is with CARF. All of our services are accredited. We are the only company in Michigan that is accredited for employee assistance services, and only one of 6 in the entire country that are. So we take the accreditation very seriously. The reason that we get accredited is because it really establishes a quality standard that we're following, that we have to ensure that we meet. This usually lasts every 3 years. We are due this year to have our accreditation come in. It usually takes a couple days, and it's a lot of work to prepare for it. The other thing that we do that I believe is really a differentiator for us is our trauma-informed work. We went through a trauma-informed learning community to improve our services. The idea or the definition of trauma-informed work means that we understand that everybody in their past has some level of trauma, and how many experiences of those are the more trauma markers that you have, the higher correlation there is to substance use and mental health issues. So for us as an organization to be able to develop our services, make sure the way that we welcome people into our agency, the way we ask questions on our assessments, the way that we approach people when they're struggling, that's all part of our trauma-informed work. And we went through a full learning community. When we launched our electronic healthcare record, we were able to take those principles and build it into how we do our assessments and how we work with people. We go as far as we bring in outside counselors to do trauma-informed supervision. A large service line that I'll get to is our peer recovery coaches. As you can imagine, there's a lot of history that our peer recovery coaches come to us with. And so we do trauma-informed supervision with them so they can talk about what they're experiencing so that they remain healthy to work with the people that they are serving every day. Some other things that we've done that have been pretty cool is we have been awarded twice from the Macomb Business Awards and from Court Magazine for our diversity, equity, and inclusion work. We are currently working with a consultant to make sure that we are addressing what we need to address. When you look at substance use work, there are populations that are underserved in our area, and making sure that we're addressing how we as an agency work helps us connect better and serve a greater population. We've also were awarded the Corporate Citizen Award from Macomb Business for our work that we do. And then we were one of the finalists for Cranes for Best Managed Nonprofit. It's very hard to talk about that, but we do a lot of work. So my staff gives me a hard time and says, it's not bragging. You have to talk about that because we do a lot of work with it. So I'll get into what our services are and then kind of narrow down into what's specific. So it sounds, we don't really have an elevator speech for our services. It's very difficult, but they are very much related. And I do tend to use industry terms, so just correct me if you're like, what is that? Raise your hand, interrupt me. That's completely fine. So employee assistance programs, I'm going to start there. Does everybody know what those are? Yes, no? Did I hear a no? Okay, great. So employee assistance programs are what companies purchase for their employees. It is really designed to increase presenteeism, to help the workforce be more productive, to address short-term problems that are coming up, to help HR people who maybe are really struggling with, I don't know how to address this. I could tell you a lot of really fun stories on things that HR people will call me about on how do I address this with my employees. And so we provide that service to companies. Usually it involves counseling sessions. The root of employee assistance programs is in the factories and unions where there's substance use, and it really kind of evolved to more this holistic approach nowadays where we're at. So we offer that service. We started in 1978. We serve a lot of the Macomb County municipalities and schools. That's really the lion's share of what we do. We do a lot of first responder work. When we talk about first responder work, we do crisis support for them when they have horrific accidents or they're struggling. As we know, that's a very challenging job for a lot of our first responders. So we have a critical incident stress debriefing team that is formally trained and registered with the state. We just do a lot of work. So how does that relate to the older adult committee? As you can imagine, once first responders retire, that is really where we get into struggles with mental health. And so a lot of the work we're doing is trying to, it's a young retirement in general for a lot of people. The average police officer, firefighter are retiring in their 50s, early 50s. So that's a young retirement. So they have a very active life, but really they haven't addressed a lot of their mental health through there. So that is my passion and what we're doing through our EAP work. Student assistance is very similar to that. What we provide is one-time assessments to the schools. Some of the school districts since COVID are paying us to do some counseling with the students that are there, but it has been a tremendous challenge with what our students are going through. I could go on for a whole presentation on that, but I'll just leave it there, that is a partnership that we have with the MISD and with schools. Our family case management programs, we have contracts with the Macomb Department of Health and Human Services to be able to help parents that are at risk of losing their children due to substance use maintain their relationship and to have those kids come home, or to really improve that they can stay there. What we do know is that when children are in foster care, they are more likely to be abused or neglected than even the home that they came from. So the goal is to always try to keep that family together. And one of the contracts we have is really helping families stay together and to really address the substance use there. We also do programs through the United Way and through the state of Michigan that are helping parents really engage with their kids and make sure that they're recognizing how to interact and discipline and coach their kids, as well as recognize developmental needs that their kids will have. And then I get into really what I think most of us know us for is our substance use work. And I'm very passionate about, we're creating a system of care. We don't really create pockets of substance use work. We have contracts. Our biggest contract is with Macomb County Office of Substance Abuse, and we provide prevention services, treatment services, and recovery services. So the whole continuum. So if you think about behavioral health and you think there's a continuum of care, that is what we do in the substance use portion outside of residential treatment, which as long as I'm the CEO, we are not getting into residential treatment. That's very, very difficult work, busy. But so I'll start with recovery and move forward because that'll allow me to end with what Marcia does for us. So our recovery work is, we opened a center in 2020. Our open house was supposed to be, I'm not joking, March 16th, 2020. And you can imagine what happened. We had a large federal grant in Fraser. It is the Recovery United Community Center. I invite everybody to come by. It is a lovely building. And what we offer in that building is a whole host of programming for all levels of recovery. And it's somebody who could be in recovery for 20 years. So today we launched, for example, our nutrition services. And the idea that, when people have substance use, there's a lot of comorbid issues that are occurring. It could be nutrition. It could be just wellness, neglected health care, dental needs, all of that type of stuff. So our programs there are to really design to wrap around the person and to address that whole aspect. We house most of our peer recovery coaches. If you're not familiar with what a peer recovery coach is, it is a person in long-term recovery who then helps other people. I don't know if my staff necessarily likes this example, but I think it's a great example. If you've seen the movie Erin Brockovich and you think about it, she was kind of a peer to that town, and then she had an attorney that could do this. Independently, they could not help that town in that way, if you think about it. So you had her who connected with people and said, listen, this is why you need to trust. This is what's going on. This is how I'm going to help you. And then you had the attorney that was able to do the more formal things. That's how we approach treatment for substance use. You have that peer coach that can walk alongside that person and say, yes, that was hard for me. Yes, I know your family's not forgiving you. Yes, I know they don't trust you and they're hiding all their money in their house, even though you've been in recovery for a year. And then you have the clinical person who's really able to talk about the more in-depth, private aspect of what somebody's recovering from. And so we partner those together, and that's what we do that's really unique. And the peer recovery coaches in Macomb County have to have 4 years of recovery, long-term recovery, and they have to be credentialed from the state of Michigan. So we have a very robust, very nice peer recovery coaching. I just cannot say enough about them. They are in this building. They provide a host of different recovery services. We have a partnership with the Detroit Institute of Arts. As we know, a lot of people can't always engage in talk therapy. Lots of times another expression is a good way for them to really recover and to get some of the things that they're struggling without. So if you come to our building, you're going to see really amazing artwork that's created by the people that receive our services. Pete Lucido came by last year, maybe 2 years ago, and he kept wanting to try to get the art. He said, oh, I need this for my office. We're like, no, you're not taking our art, buddy. This is our art. So, but it's really remarkable, and it's a nice project that we do. We're doing GED classes. We're doing resume building. So when you think about somebody, what we know about recovery is it's really connections. And when we went through our trauma-informed learning community, that's what we really learned about people healing from trauma. It's about the partnerships and the connections that they have with other people. And so that is what we're doing in that program, is really wrapping around people and giving them a chance to get out and get work and to find new friendships and new relationships and way to engage with life. Our clinical program, this is something that has really been a huge development for us. So we do outpatient therapy, we do counseling. So it's kind of the whole gamut. We just do some assessment. So if people need their driver's license back, they'll come in for an assessment for us, and that's part of what we do. Somebody's been arrested for a DUI and they need a substance use assessment, we'll do that. Department of Transportation assessment. So let's say your bus driver at SMART tested positive for drug use. The Department of Transportation has a big structured way that you have to work with a therapist to be safe to go back. We do those assessments, and that requires a specific certification, which is called a SAP, which stands for Substance Abuse Professionals. We provide that service to the community as well. And then we have our youth programs. We're contracted with Macomb County Office of Substance Abuse to do outpatient counseling as well. And then we have a large grant that is Teen Solutions, which is partnering teenagers and their parents with a whole wraparound model to address substance use. Our clinical department is just growing by leaps and bounds, so you'll hear more coming up about that. And then our prevention services, which I really like to talk about. So prevention, if the only way to do prevention services is to be part of the public mental health system. So Blue Cross Blue Shield doesn't really pay for substance use prevention in the way that the public mental health system does. So I could talk all day long about how amazing the public mental health system is and what's unique about it. What we do in our prevention programs is we are over coalitions, which is bringing the community together over a topic that's important to that community related to substance use. We do in-school programming, which is building life skills. It's addressing vaping, which is a tremendous problem right now, the level of vaping that's going on. Other things like alcohol and marijuana, obviously, is another concern. So we're doing these programs in the school. And then we also have our older adult programs that we do, which is those education one-time programs that you get out. And I am going to read the list because I don't want to wing this one because I think it's pretty amazing what we do. So we go out and we do topics that it's brain fitness, senior staying sharp, aging and alcohol, when one drink is too many. When is one drink too many? Normal aging changes, aging and the disease of addiction, depression, dementia, facts and fallacies, and learning and memory. So when we talk about substance use, we always sort of think, we don't really consider the idea of accidental misuse. We don't really talk about misuse. And so what's really important when we think about older adults is the concept of misuse. And I think everybody's aware of the statistics that people are given prescriptions and what percentage do not take them accurately. And so when you're looking at some of the prescriptions, that can create some struggles for substance use that are unintended. And so that is a big important part of our programs that we deliver. And then I had one other thing that came to my mind. I went, and then the other thing with I want to go back to our peer recovery coaching because I do think that this is important. We're in the hospitals and the emergency departments. And what we do in the emergency departments is a universal screening to people that present with substance use issues, maybe an injury. Maybe somebody fell and hurt themselves because they had one drink too many, and we'll work with them. And at that point, we make a decision based on a standardized score on a screening tool. Does this person just need some education? Do they need resources? Are they good to go? And it was just really a complete accident and everything's fine, and we provide those services too. So I think I covered everything. I'm not as exciting as the dog guy, but you know.
I think you're very interesting, and I'm
Thank you
really
very
glad
much.
to hear everything that you had to say. I'm sure there are questions. Is there anyone who wants to start? Let's see, you started that last time this side. Is there someone over here who would like to start with
You
questions?
deal in Oakland County then if you're southeast.
We do. So we have contracts in Oakland County that we provide schools, programs in the Hazel Park School, and we also have programs in Wayne County. So we serve Harper Woods and the Grosse Pointe communities through our prevention programs. And then our EAP line sort of spreads all over. Like we're in Washtenaw for a lot of those services as well. I don't love our name of our agency, I'll just put it out there. Like care and hope is everywhere. Poor Care House, like a good thing that we're good friends with them because we get each other's calls all the time. Yes.
I have a neighbor who has about a 19-year-old son, and he said it's switched and trying to figure out how to get him off substance abuse. Is there a place that he could call to get advice?
Yes, our Recovery United Community Center is a great place to start.
Do you have any information, like, for somebody like that you could give them some information to read upon or get them going, maybe some motivation?
So you mean motivation to change?
Yeah, just to say, I got a call. You know how some people are like, nope, don't want it, but.
Yeah, it's a tough thing because when you think about there's a whole model that's called motivational interviewing and stages of change. And so that's really the way that you have to work with somebody that's in substance use. And so you may think, are they in pre-contemplation or contemplation? Are they in preparation or action stage of change? Because how you work with them is important based on that stage. And as you can imagine, what I'm probably going to say is if they're in pre-contemplative stage of change, you're just really just laying out the information and they decide if they're going to take it. And that's usually the biggest struggle that I think a lot of places have in families is how do you take care of that loved one that's not really ready to change? And that's what a lot of harm reduction work is for. So there's a lot of stigma around harm reduction work and why would you do that? And one of the things I always see is that the memes about Narcan, so the antidote for sort of an opiate overdose, like why is that free but diabetic medication so expensive? I think it's a great question. Why is diabetic medication so expensive? I mean, I think that that's the discussion that we should be having. But that's what a lot of that harm reduction work is. We know somebody's not ready to change, but we want to be able to mitigate and reduce what's going to happen. Our work in the hospitals is pretty amazing. Anytime that we started a new hospital and I sit in that meeting, there's a lot of concern from the medical staff. What's going to happen? Are they going to have access someplace? And what we don't talk about is the stigma that's associated in the fear that we have. And when they meet somebody who's been in long-term recovery and they start hearing their story, they're like, you did that? And that's why they really create that story. It is worth it and it is possible to change. And there's some really good things that can come of that. So it's probably a long answer to, I think, a difficult question.
Is there support for families?
Yes, so there are supports for families. We do have one group that we do. It is a little bit more challenging to be able to work with families without that person present. That's why we wrote the grant for our teen solutions the way we did. So we're bringing in a family coach. So the idea that any service in behavioral health has what we call peers, which is somebody who went through it that's able to offer advice. And so there are family coaches that we are currently training.
Now, does your help come if they're only drug addicted relationship or if they're just mentally ill?
So that's a great question. The way the public mental health system is divided up is by service populations. And the idea is that we're always co-occurring, meaning you can serve mental health and substance use together. So we do serve people if they have substance use and mental health. We do not currently really do anything outside of maybe an assessment for teenagers for strict mental illness that you would find some other agencies are doing at this time, but that'll change.
Okay.
I have some questions for you. How many workers is it an office that you have?
We have two buildings, yes.
So how many workers do you have, or how many social workers do you have?
It's two different questions that I'll
Yes.
answer separately.
Yes.
So I have a- currently probably about 66 full-time staff and another 25 to 30 part-time and what we call casual staff that do work. So social workers, I am assuming that you're asking therapists in that regard.
Okay.
So I currently have 5 therapists and a clinical director.
Oh,
Yeah. So, but out of all the staff, there are people who have their social work degree, maybe a bachelor's or a master's, that work in the prevention program. The prevention program requires a credential as well from the state. So it's everything that we do requires extra training. It's not enough just to come in and have a degree and we train them. They are required to be monitored and go through the entire process through an agency that is the Michigan Board of Certification for Addiction Professionals. And it's usually a 2 to 3 year process to get those credentials.
right, because a social worker has to have a master's degree, correct?
There's bachelor's and master's, and it just depends on what work they're doing. And they also have to be licensed. So it's not just as simple as having the degree.
So how many young people, who would counsel them then, or who would work with them then? Therapist, are you saying?
For our
Workers?
clinical programs, they are licensed therapists. And to be a licensed therapist in Michigan in general is either a master's social work, a master's degree in psychology, or a master's degree in counseling. And those all have their own separate overseeing body through Laura that license them. And then they have to do the credential because they're working with substance use as well.
Yes. And how many adults, so how many young people does your company oversee?
What do you mean by young people?
Well, I guess that we have to break down, I guess 18 and younger, or do you have to break that down?
So it's so throughout we cover and work with 100,000 people a year, and that number comes to our contracts that we have for all the people that are in EAP and all the students. So when I count that we are funded to provide services to, let's say, the school district of Utica is one of our school districts. All of those students are available to come into our services. Now, does that mean they all do? No. But in general, the scope of what we're touching and what we do is about 100,000 people. How many people do we serve in a year that come in for our counseling and work with us? That's going to fall in about 10 to 12,000 people based on all of our education classes that we do, the individual therapy that we do, the work that we do in the hospitals. It's a lot.
Yes. And adults, how many adults then do you work with in a year?
That number included adults and kids. I haven't
Okay.
really looked at the numbers in the past year for how many are adults versus kids.
Well, I can't imagine. That's incredible.
It is. It is incredible, and it's an incredible staff that does a lot of really good work that gets out there. And that's what's unique about our agency versus maybe a clinic that only does treatment and therapy. Because we do so many educational programs and our parenting work and our parenting conference, we just reach a wide range of people in the community.
Thank you for doing that. Please thank your staff for doing that.
Yeah, they're pretty incredible. It's great. And
Yes.
the energy is great. And when I started at CARE, it was pretty interesting how many times I would go out in the community. I'll just say I'm from Ohio originally. I'm sorry to say that. I am. I went to U of M, though. I went to U of M. So that's how I ended up here. And so when I finished at U of M, I worked in Oakland County at Easter Seals. And then we realized, my husband and I, we can get a much better house in Macomb, and we have a boat. Why aren't we in Macomb County? So we moved here, and then I ended up working at CARE about 2016. So it's sort of my first professional experience. It was remarkable. Every single meeting I went to, every place I went, somebody was like, I interned there, I used to work there, My family received services from there. It is truly incredible how that's out there. And, you know, the way that we're funded, if you think about this, we don't receive funding to do marketing. We receive funding to do services. So it's kind of this idea that it's undercover and a little bit lower. I mean, you're at McCrest. McCrest doesn't market. You don't have money to waste on marketing. You have to get out there and count on the community to really support your services. And so, you know, we do a lot. It's great.
Well, I'm certainly not educated in your area. I worked alcohol and drug rehab for 3 months with a charge nurse, she and I in afternoons, and I still remember what that was all. It was a learning experience for me. And I still remember it all. I saw everything, I mean, from every perspective. And she was a great teacher. But when you go to today, and I keep hearing mental health for so many people, so many young people, and I keep thinking how sad it is that seems to be an expectation now. And everything, I think, comes from the heart. Where's their heart? And the heart is really what runs the body and the mind. And if life would just be simpler for people, especially our young people. And when you say that you're having all these vaping and things, I mean, I just like to go through the room and grab everything and just break it into a box and to get rid of it. Because they just all do what the other person does.
Sure.
It's just the way it's probably always been. Not everybody, but they're just looking for friends. They just want to find a group of friends. And it's so sad because it doesn't have to be this way for them.
No.
They've all been specifically created by the Lord in His image so that they have a wonderful life. That's what everyone have been created for. And to see that they're so lost, it just breaks your heart when you'd like to see them be happy and fulfilled and have a life that they deserve. We just have to reach their heart.
And I will say this is something that's very important for me to message as working in the field of substance use, especially with adults. There's sometimes a lack of empathy for somebody that's struggling with substance use, and we feel that it's willpower, they created it themselves. And one of the things I always say is that didn't start at age 30, that we have so much empathy for children that have been neglected or abused in what they've been through. And we just magically expect people when they turn 18 to be able to be self-directed and to make good decisions when there's trauma and experience in their past that really has created their framework of how they're going through life. And if we could just have a little more empathy for that adult that is struggling, I think that's really, because they become parents too, and it just perpetuates the cycle. And so that is my message I like to say is just remember at 18, we don't start over. We still bring into adulthood what we've been through as a kid.
Yes. If we could just love everybody, just like everybody a little bit more.
Yep.
Does anyone else have anything else they would like to add? Thank you all. Thank you so much for coming, Susan.
Yeah, thank you so much for having me. It's
Yes.
great.
It was
Gets
a
me out
lot
of the
of-
office.
There was a lot of information, and it was all great to hear. And again, thank you so much for what you do and your staff do for our citizens and our young people. We hear this on the news, but to have you here, I am so thankful, and I know the other people here are very happy that you came. Thank you
Thank you.
very, very much.
Thank you very much.
Thank you. Okay.
What do we? Yes. Okay. Motion for a voice vote, please. I'm sorry. I just have to.
All in favor?
Are we all in favor for the receive and file? Is it a receive and file? Yeah. Do we have yay?
Yay.
Are there any nays? No. All right, thank you very much. Now we're going to Oh, I'm going to turn this over to Adriana for the next two events.
So we just had a couple of things we wanted to bring to your attention that will be coming up. We just had nominations for the board's volunteer recognition program close this past Friday. So next month you'll be voting at your meeting to choose the senior volunteer of the year. So I will get those nomination forms to each of you. It details all of their information from whoever nominated them, so that you can review those before the meeting, and then you're prepared to vote on that at next month's meeting. So that will be, I'll probably email it to you ahead of time, and then I'll include it in your packets when I mail those out too. And then the other thing I wanted to mention, we just found out that Senior Action Week through the Area Agencies on Aging this year is taking place May 15th through May 19th. Older Michiganians Day is right in the middle of that week. It's Wednesday, May 17th. There is going to be another live stream event this year, and that's from 11 to 12:15 that day on the 17th. So we're going to do like we did last year. We'll put together something for those of you who can join us. We'll do it probably in the committee room again, and we'll have the live stream up. Hopefully there'll be some additional ways to participate this year. I'm still trying to get some more details on that. So as soon as I have that, I'll get that scheduled. That will take place of your May meeting. They're also, I noticed, looking to get letters of support again, like you sent last year. So that's something, if you wanted to do, you could consider doing a letter for that on next month's agenda as well. And I think, yeah, that was it. Any questions on? No.
Are we going to speak about going out?
Oh, I can mention that. Yeah. So we'll have our April meeting here again. May will be the Older Michiganians Day event that we'll get information to you on for sure next month. And then starting in June, we'll be scheduling throughout your communities. I do have several places who are interested. I was kind of holding off, waiting to find out for Older Michiganians Day how that was going to go, to see if we wanted to start that in May or June. So we'll start it in June, and we'll get that schedule again to you as soon as possible. But if you have any other locations you think might be good or that you'd like to see, just let me know, and I can get a hold of those as well. We do have, I know Sinclair Shores is interested, Harrison Township, Shelby Township, and we were going to check, Chair Brown goes to the Richmond. They have like a seniors lunch every month, so we were going to see if that might be a possibility to join them there. So, yeah.
Do you now, have any of you spoken to your senior centers, your leadership people, about coming to their, yes.
Yes, Macomb Township would put out the welcome mat, keeping in mind that they're under construction.
Oh, are they? Okay.
And if you've tried to clear 23 in Romeo Plank lately, that's also under construction. So although the welcome mat is out there, they were thinking you might want to wait until next year, but that's up to you. Do you anticipate that the meetings for the rest of the year will be at rotating locations?
Yes, I think the idea is starting in June. Hopefully, we'll be able to do that at different locations. Yeah.
Okay, and that will be for the rest of this calendar year?
Yes. Yeah.
at least?
Yeah. So June through December.
Well, certainly, yeah, Macomb is open to that.
Okay. So
what-
maybe later in the year would be better. I can always reach out and
possibly.
see. Yeah.
It's hard to
I
tell.
know. You never know. Yeah, I can reach out and see. That's good to know.
So will the dates of our meetings continue to be different every month?
I'll try and keep it as consistent as I can, but I'm thinking depending where we're going, it unfortunately might have to be a little flexible with that. Yeah.
Also the times.
And
We're
the
not
time,
sure about the
yeah.
times of when they might want us to come.
Right.
It seems like, so far, it seems like a number of them, like more like midday might be a little easier. So, yeah.
So if we had to go at noon, or what, I'm not sure. Really, I don't know what, my two areas, the one said noon. I don't know what the Shores would want. How many people here would have a problem coming earlier than 3 o'clock
for me, it's a day of the week and day of the month kind of thing more so
Yeah.
than time of day, because to, schedule out for months in advance with other appointments.
Right. Can you raise your hand if you think generally earlier in the day is a problem for you or not? It's not
Some days.
necessarily?
Some days might be.
What day it is, yeah.
Yeah, we're retired.
Yeah, it's hard to keep up with the retired.
It is.
Okay, thank you all very much. Is that it?
I'll email the contact people
Oh,
to you
great.
for that.
Okay, thank you, Kathy.
Is it a large building project, apparently, that they're working on in Macomb?
Depends on how much money they get.
Well, we should say hello to Commissioner Van Sickle over there. He's waiting, I guess, which is very nice.
Can I ask for clarification? Going forward, do you have any locations named yet, like June or July, or are you still working
No,
on
not
it?
yet. I should
Okay.
have that very soon, though. I wasn't sure if May, what exactly we were gonna do for Older Michiganians Day, so I wanted to get that squared away first. Otherwise, we could have maybe started there in May, but, yeah, so we'll start in June. So I'll try to get that as soon as possible out to all of you.
And we didn't know if any of you had, what your cities or your township, if your people had dates in mind, or we weren't sure how you felt about everything. So now that this is all settled here, or kind of settled
Yeah,
here,
we're getting there.
Adrienne will take care of it. She just does everything.
And this will be open to the public when we have a meeting at the
Yes.
senior center?
Yeah, so we'll hold it, it'll have it just like your meetings here, except we'll be out in the community, so, yeah.
And we won't have, I don't know that we'll have mics.
Yeah, it probably just depends where we are. I know some are set up, like for a whole, the recording and everything like we do, so I think it'll just depend where we're at. But we'll figure it out.
Well, if it's a senior center,
Yeah,
I don't know, because it'll be in the senior center, not in their boardrooms.
yeah.
don't know.
Some, like I know, Shelby has a room, it sounds like where they're able to record and stuff, so they may be equipped with mics, so
Yeah,
yeah.
they might be able to record.
Yeah.
Okay, good. We are now to public. Does anyone have anything else to bring up? Oh, comments come after, sorry. We are now to the second public participation. If anyone in the public has anything that they would like to speak about at this time, please come to the microphone, if there's anyone.
Afternoon, my name is Fred Neenstead, I'm Clinton Township. Not quite retired yet, but I thought I'd take a look, might be what's on my horizon. But I'm glad to see everybody here. I'm kind of curious, I read a lot, I try to keep up on community events, our state events. And I noticed that some of our communities are struggling to educate the children. They're not performing as well. Perhaps that's from COVID, a little back lag from COVID, getting them back up to speed maybe. But it seems to me that allowing children to get by with just a little bit less of a standard is not really an option. It should never be an option. I mean, I've made the statement a few times that it should be a crime against humanity for a third grade child to not know how to read and write. The thought that they would pass third grade without that skill is terrible to me. Is there any kind of a program in Macomb County where older adults who are retired and have time are mentored or tutoring younger people and helping them just understand, even if it's a second language English? Is there any opportunity for that? Is it something that maybe insurance or law stops it from happening? It seems to me that these are barriers that should be broken, if that's what it is. I mean, obviously, safety is number one, but compatibility and understanding, I'm sure a lot of people who are older would greatly appreciate the opportunity to help. But I don't know if that kind of a structure could be or is or does exist. I'm just asking, perhaps you can fill that need in some way. Maybe it's already being done somewhere. just needs to be referenced. I'm hoping that it's a good outcome for all concerned. Thank you.
We are now coming to, do you make comments here? Does this run like the other board? Yeah. Thank you. We're going to member comments now. Do you start in a circle? Do you just let people, how does that work?
Just see if anybody has any.
Would anyone like to make a comment? About anything? Ladies? Anybody over here?
I would comment on Fred's statement. You know, as a retired person, there's a bunch of us out there that would help if we could. Now, I don't know if the teachers' union objects or where the objection would come from, but I certainly think it's possible to tap into that resource.
I find that very interesting, and it may not have to do with anything to do with the union. It may just be privately.
Now, you might have to do it community by community, but still, I mean, there's a lot of seniors out there, I think, would jump into this.
I've heard of an organization called New Way. It's NEWWAY, and they have mentoring programs. Again, you practically have to do it one-on-one. I know they've had some big fundraisers, and that's been on the agenda to find out exactly what they do and how they do it. And I know they work a lot in Mount Clemens.
Yeah, I have been there.
With New Way?
Yeah, I've been in there before. Yes, I know they work with children, and they've done some great things and have plans for great things. They have some great people. I don't know about this per se, one-on-one like that. Yeah, I know they really, they're very committed to children.
Yeah, definitely.
That's a local
Yes.
community or group?
Yeah, like I
Yes.
said, I'm pretty sure they're in Mount Clemens.
They're in downtown.
Yes.
I know Shane is one of the
He's the founder.
founders. I think his last name it begins with a G, and it's Italian.
Giacona?
Something like
Giacona,
that.
I think.
And definitely seen him at events, and I've definitely, I've seen him a lot on Facebook, for sure, about this organization.
I think also to connect with an individual school district, and some of the public libraries have tutoring programs. And so if you're interested in volunteering, you might consider the local library or the school district and call and find out. And as far as a gathering of older adults who are retired and have time together, you might meet them at the senior centers or at church or someplace or at some of the service clubs, and maybe get something going then. But I just wonder, then there's boys clubs and girls clubs, and I don't think there's a universal way, but to volunteer sometimes, if you can make a difference with one person, that's what it's about. But thank you for bringing that up.
Well, I think that's something we can think about, and you may want to take back to your people, and it's a great thought. Thank you, Mr. Ninstant. And I think at this time, we may be thinking about adjournment.
Motion to adjourn?
Motion to adjourn from Mr. Wilson, and who supported? Mrs. Bishop? Okay, Mrs. Bishop. I think,
Yes, we're done?
I think we're done. Thank you all very much. I had a very nice time with all of you. Thank you very much.